Angau's cancer treatment facility is the only one of its kind in the country. As a unit and a referral hospital, it gets dozens of patients every month from all over the country, but its ability to do its job has diminished so much over the years that it can't save lives. At a public forum in Ley organized by the Special Parliamentary Committee looking into health service delivery, Dr. Jim Abrams, the only senior health professional who attended the forum, made this statement to those present.
Do you know what the cure rate for cancer of the cervix of stage 2 in Papua New Guinea is? Any guesses? 0. So nobody we treat actually gets cured. Now that's a shocking indictment when we have the treatments available in the world to stop this from happening. These people are dying unnecessarily.
As Chief Executive, Dr. Abrams is confronted with significant hurdles: poor facilities, staff absenteeism, and slow bureaucratic processes that contribute to poor health care.
The head of the cancer services has actually said, we're not a cancer centre, we're a palliative care centre. You know what that means? People come to us with cancer and they die. They're going to die, so we just make it comfortable for them. That's what a palliative care centre is. So that's what we've been labelled, a palliative care centre. And yet we can do better than that.
For the cancer unit, the hospital has been waiting 3 years for a cobalt source from Canada and for an expert to decommission the old machine.
There's a procurement company from Australia that can bring it in here in 3 weeks. So you would think, and this is not news to the Department of Health officials. So I just need somebody in the Department of Health to make the decision to say, get that source, get it into Angau, let's help us at least improve patient care and hopefully save lives.
Personally, me like in government, it can look more, go inside, look it up in Angau hospital, look come up in the another bigger hospital inside the country. Look this place service belong cancer.
Even without an investigation, the fact-finding mission alone by the Special Parliamentary Committee is revealing evidence of years of neglect and showing a health system that is crumbling from within. 2 weeks ago in New Ireland, the committee was told of how funding shortages were crippling the rural and urban health systems. Officers in charge of health centres couldn't implement the government's free healthcare policy because the services would collapse if they did. The series of visits to KVN, Kimbe and now Ley has put members of parliament in the committee in contact with the concerns raised by health workers on the ground. Now those concerns aren't usually heard because they're drowned by layers of bureaucracy that exist in the public service. This afternoon the committee left for Goroka, where they're expected to meet with staff of another hospital in crisis. Scott Waide, National EMTV News, Ley.